I'm Dr. Scott Brown. I'm board-certified chiropractic neurologist in beautiful Lakewood, Denver, Colorado. And I love kids and I love special kids. 1 out of 7 children today have a developmental learning disorder. So, without any further ado, I want to explain to you how brain-based therapeutics can help your child. And here's how we think it differs from all the other treatments out there. Nature has given us a large brain as humans, and as a result of that, we have what's called bipedalism. So the sensory information coming from both feet are driving our brain function. And what has happened is, in order to get greater survival ability, lateralized brain function has occurred where one hand is used for stabilization, one hand for accuracy. And that's just one of the millions of differences between the two sides of the brain. So as this lateralization has occurred, there's developed a need for a communication between the two hemispheres, which is only 40% efficient. And so what we're finding with these developmental delays is that one hemisphere of the brain is dampened or not functioning as well. And that is where functional neurology comes in. Now, let's look at right and left brain function. The right brain, you know, has been always considered the emotional brain, and the left brain the logical, but there's much more to it. The right brain is also math reasoning, whereas the left brain is math sequencing, so different types of mathematical abilities. The right brain is the negative side of the brain. It's the street smart side of the brain, whereas the left brain is the positive side of the brain. The right brain is spatial, and the left brain is declarative or didactic. The right brain is the learning of anything for the first 60 seconds, is a right brain activity, whereas once you learn it, such as speech, and it becomes like I'm doing now, speaking to you, it becomes a left brain activity, and so on and so forth. Now, with ADHD, it's considered an uninhibited brain. And these kids are truly the kids who can't put brakes on their impulses. And they are behavioral problems as a result of this. Whereas the ADD, the attention deficit disorder, are kids who have what we call a sleeping brain. They have gaps or holes in the brain where they can't remember things, where things slip through. These are the kids that have hand-eye coordination problems due to clumsiness and disorientation, and so on and so forth. So two different aspects of activity and two different parts of the brain. Now, the ADHD kids are a frontal lobe and a temporal lobe problem, and this is considered the lobe of the sky. The ADD kids have a parietal lobe problem, which is above the temporal lobe and is considered the lobe of the ground or the hand. So these are the kids that don't play sports very well because they can't put together the hand-eye coordination, whereas the ADHD kids don't do sports very well because it's a social activity and their executive function is dampened. Now, in this innovative type of treatment, our emphasis is on stimulating the dampened side of the brain. So when we do adjustments, the chiropractic adjustments are done to stimulate the part of the brain or the area of the brain involved in that is in deficit. And so 80% of the function of your brain comes from the stimulation from muscle spindles and joint receptors. So this is a very, very powerful part of the treatment in targeting the part of the brain that's involved. But it's not everything. There are cognitive exercises where we have puzzles and games. There are eye exercises for the part of the cerebellum in the back of the brain up here, which is tied into these areas of the brain. We have music that is listened to stimulate certain areas of the brain, and so on and so forth. Now, I know many of you are desperate right now, and you can get on our waiting list to come into the office. But for those who need something right now and you're not sure where to go, or you can't reach us here in Lakewood, Denver, and we can't find a doctor close to you, there's one thing that you can do at home right away without any investment of time or money like this. A recent study showed that 132 kids that had ADHD who were put on a gluten-free diet without any testing to see any type of gluten sensitivity, genetic or otherwise. In 6 months, there were significant behavioral and functional changes in every one of the 132 kids. If you get your child on a gluten-free and dairy-free diet alone, without even worrying about testing, the chances of you having a significant improvement right away within that period of time are very, very great. Now, this is not the answer to everything. You can, again, find this out from my team. You can call, we can give you websites, or put you with people who can come to your home and teach you how to get off these diets. And of course, this is a part of our expansive program that we have for these kids. I would really like to help those of you who are able to come in and be evaluated. I will spend a 5-minute phone conversation with you before you get on our waiting list to see if you qualify. Thank you, and you can look at our other videos on our website to see other videos about autistic spectrum disorders, which are a little more advanced than what we're talking about here. So thank you very much.